Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
Welcome, welcome everyone. I'm glad you joined us today on Heart of Health Live, where you make up the program. And today's topic is something that everyone will want to log into. Even if you don't have a question, you will want to listen, because this topic will affect either you or your loved ones. We have a specialist in urology, specifically urological surgery, and that's Dr. Lee Jackson, and he's volunteered his time to be here tonight to answer your questions. So if you have a question specifically about your prostate or some type of the urogenital, that's where the kidneys and the urine comes out. If you've had problems with that or have a question, well, we might be able to help you specifically about a prostate or maybe a prostate cancer. We've had some questions about stones. We'd be happy to answer your questions. And the way you can get a hold of us is dial your phone. It's toll-free number 855-644-3278. Or you can go onto our website, that's heartwiseministries.org. Or if you're interested in following what we're doing from week to week, you can become one of our Facebook friends and joining the conversation on Facebook. I was lucky to have Dr. Lee Jackson on our radio program a few weeks ago, and a lot of questions came in, and I knew this is a topic that we wanted definitely to talk about. There's so much that's been going on in the news lately. You know, we've heard about the disaster that's happened in Connecticut. And on the news, all I hear is about gun control, but we're also talking about some of the psychiatric issues that come up. We've also talked about ways we can improve the health of our country. And unfortunately, I don't think health can be legislated. I don't think they can make a law that's going to make everything right. I think they'll try, but I just don't think they can do it. So each one of us has to take personal responsibility. And the first start is with education. So I want you to learn today about your prostate and all those things that go with it. Stay with us on Heart of Health Live. We're going to be right back, and I'm going to introduce you to Dr. Lee Jackson right after this short break. Stay with us.
The Heart of Health Live will return in just a moment.
Thanks for watching the Heart of Health Live.
I'm Dr. James Marcum with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thicken, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in two, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Marcum is doing in your area, visit heartwiseministries.org.
Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time. So here's a question. If you love Jesus, and I mean truly love him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Glad you've all stayed with us. I think we've talked about our topic. Now let me introduce you to Dr. Jackson. Dr. Jackson, welcome to Heart of Health Live.
Well, thank you.
And tell our audience, how did you get interested in learning about urology and urogenital disease and all this?
Well, my intention of going to school was to become a surgeon.
Okay.
And then as you rotate with the different services, I just was drawn to the kind of people that went into urology. I enjoyed their company. I found the topic and the subject matter interesting. And when I selected a residency, my plan was to be a kidney transplant surgeon. That's actually my formal training was in renal transplant.
So now, were you one that always wanted to be a physician, or did you sort of just happened?
I don't have any memory that didn't include becoming a doctor. It was just a given all along.
So I mean, how many? So you spent. I know you spent 4 years in medical school. You have to do, I guess, a residency.
Right. Yeah, the residency, including the transplant fellowship, was another 6 years.
6 years. Now, did you do any transplant work, or did you?
I did. For the first couple of years, I did transplant work. I was with an organization called the Cleveland Clinic, based out of Cleveland, Ohio. And at the conclusion of my training, they were beginning a new branch down in Fort Lauderdale. So I got selected along with about 20 other guys to go down to Fort Lauderdale and open up the Cleveland Clinic, Florida. And it took us a while, years, to get a certificate of need to do transplant. And I responded to the need at the time down there, which had more to do with urologic cancer.
Right.
So as a result, most of my experience and practice has been devoted to urologic cancers.
Wow, well, that's great. Well, we have some questions that have come into the website, and we're going to at least get started on the topic. We might have to go to break in a second, but our first question that's come into our website says, I recently had my PSA tested while getting some blood work done, and what does this measurement tell my physician? So let's sort of talk about what is PSA.
What is PSA? PSA is a normal, benign, harmless protein.
Okay.
And that it is specific to the prostate. The only thing that makes this protein is the prostate. That's what it stands for, PSA, prostatic specific antigen. Antigen is just another word for protein. Having an elevation in the PSA is not inherently dangerous. We don't treat elevated PSAs, but it does direct our attention to the prostate and why is this level of protein elevated or changing. And the most controversial use of it is when we use it to estimate a man's risk for having prostate cancer.
Right.
It's not specific to cancer. Just because it's elevated doesn't mean one has cancer. But we do pay attention to it when it's elevated.
Now, if it was low, could I feel like I don't have it if it's low?
Well, no, you can't.
Okay.
We learned in a large study back in the early 2000s where every person enrolled in this study did receive a biopsy of their prostate. They agreed to that going into the study, and it was about 4,000 men. Even men with a PSA of less than 1, about 6% of them were found to have prostate cancer. So there is no safe PSA level. It's rather the behavior of the PSA and the pattern of a series of PSAs that helps us estimate risk for prostate cancer.
So would it be said that this is a test that measures risk?
Yes, exactly right. And there are other risk factors as well: ethnicity, family history, abnormal digital rectal exam. We need to interpret PSA and how PSA is changing. We refer to it as PSA kinetics in the context of other risk factors. I would have a lower threshold for pursuing a PSA change in someone who had a family history, for instance. I would be a little bit more tolerant of a change in PSA or elevated PSA in someone who didn't have any other risk factors.
Wow, well, that's interesting. We're going to continue talking about PSA, and I think we're going to find out that there's an art to medicine. There's been a lot of discussion out there, unfortunately, about maybe we shouldn't be testing this, and we're going to be talking about the use of this in a general physical exam. I know recently I ordered one, and the insurance company didn't pay for it, said it wasn't justified. So we're going to talk about things like that. And if you want to join in our conversation, 855-644-3278. And we're glad you've invited us into your home to share with us today. You know, here at HeartWise, we're not selling a product. We're not trying to push anything. We just want to give you good medical information, good answers from specialists. Stay with us. After this short break, we're going to continue our discussion about PSA and answer your questions here.
The Heart of Health Live will return in just a moment.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said, or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that HeartWise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program, but we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support HeartWise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's one every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, everyone. Tonight's topic, we're talking about urological health. Specifically, we're talking about prostate, and we have an expert today with us, Dr. Lee Jackson, and he's been treating prostates for years. In our last segment, Dr. Jackson, we were talking about prostate-specific antigen, and the U.S. Preventive Task Force came up with some guidelines recently, and I don't think I agreed with those.
Well, I certainly don't. It's the U.S. Preventative Services Task Force, which was a task force assembled by the U.S. Agency for Healthcare Quality and Research. Mm-hmm. And their assignment was to review the available literature on a variety of different topics, breast cancer, cervical cancer, heart disease, right, and make recommendations based on the available literature. In my view, with PSA and their recommendations not to use PSA in screening for prostate cancer for men of any age, I think they got it very wrong. I think not only did they get it wrong, I think it's terrible medical advice. This task force was specifically designed to not include any specialists. I don't quite understand the rationale for that, but the result is that you've got a body of very devoted people, very smart people, that are a bit out of their depth when trying to interpret some very complex literature and data. And quite frankly, they misinterpret it. And in May of this year, they issued a statement recommending against the use of PSA for screening for prostate cancer. The problem with that is that prostate cancer is the second most common cause of cancer death in men, and early prostate cancer is a silent cancer. The only time we get symptoms from prostate cancer is in late and advanced disease. Metastases are usually the first symptoms, or results of metastases are the first symptoms that we get, and we cannot cure metastatic prostate cancer. The 5-year survival for metastatic prostate cancer is about 0.
Wow.
If we're going to have any meaningful impact, if we're going to be able to treat and change the course of the disease, we need to find it early.
Right.
Early prostate cancer doesn't produce any symptoms, so we have to look for it. And we look for it with a digital rectal exam and by testing the PSA. Now, PSA, again, as we talked about before, is not specific to prostate cancer, so we do have to be very careful about how we interpret it with, great thought and caution. But to not check it at all, I think, is just terrible advice.
Yeah, and we look back about medicine being an art. It's just, not one test. And the art of doing a digital rectal exam by most people as a screening exam, I think that might be a lost art too.
Well, it could be.
But this is one thing that they can fall back on and still, do some screening as well.
Exactly. And there's a great role for guidelines and a great role for standardization and minimizing variation in practice to achieve better quality. But to ignore empirical observation or experience that one gains from seeing people every day and taking care of them over the years, the art of it, to ignore that is a huge mistake, and to minimize it and trivialize it is a big mistake. It's very important.
Yeah, and once a disease is metastasized, if you can help those symptoms, you can really improve some quality of life.
True, if we can avoid the metastases altogether. Right. Since we've been checking PSA, since the late 80s. So we have a well over 20 years experience with interpreting PSA and finding early prostate cancers. The mortality rate from prostate cancer has fallen 40%.
Wow.
The incidence of metastases has fallen 75%. I mean, this is a huge success story that we're now being told we should discard and go back to.
So you're telling me that 3 out of 4 people can prevent the metastases if it's detected early?
Well, we see 75% fewer.
Okay.
And there's an awful lot of suffering associated with metastases.
Right.
So this is a huge step forward. We don't want to take one backward with this recommendation.
Wow, that's great. Well, listen, I hope everyone out there is listening today. We have some questions coming in, and after break, we're going to be back with Rachel, who's calling in with the question. And, some men are afraid to call in, but we want to invite the men. If you want to call in, or if you want to write in, or go to our website, it's heartwiseministries.org. You can leave your questions for Dr. Lee Jackson, who's a specialist in prostates and prostate cancer. We want you to stay with us. We're going to go to break, go get a glass of water. Don't watch the news, a lot of bad stuff. Stay with us and you can learn more about the prostate and all the things that go with us. We're going to be right back after this short break.
The Heart of Health Live will return in just a moment.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Hi, I'm Dr. James Marcum, speaker, director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, and I'm glad you're staying with us. Our phone number here with Dr. Lee Jackson is 855-644-3278. And right now we have Rachel. Rachel's calling us. Rachel, what's your question for Dr. Jackson?
Well, thank you for taking my call. It's not actually my question. It's my brother-in-law's question, but he's a little too afraid to call.
Okay.
But anyway, he would like to know if you can get rid of having kidney stones once and for all. He's had a couple episodes which he felt he has been close to death, and he just wants to know if he can get rid of it completely.
Okay, well, we might not be able to answer all the questions, but we can give some suggestions. Dr. Jackson.
Yeah, I don't know that you can get rid of them forever. Certainly, if you've ever had a kidney stone, you share your brother-in-law's feelings about it. It depends on what kind of kidney stone it is. If he's passed them before, they've been retrieved surgically, hopefully they've been analyzed. The broadest approach to it would really be dietary. Most stones can be influenced by our diet and level of hydration. Most stones are calcium oxalate. Things that are high in oxalate are tea and colas. So the first thing I recommend to somebody who is a chronic stone former is to eliminate all the iced tea that they enjoy so much, eliminate their colas, and substitute water. And they need to be very well hydrated. And that'll go a long way towards reducing the risk of a recurrence.
Yeah. Now, I've heard about citric acid. What do you lemonade and stuff like that? What do you think about that?
Again, it depends on the kind of stone that it is, but raising or lowering the levels of citric acid has an impact as well.
Hey, Rachel, how many stones has he passed? Just a few or a lot?
Well, I don't know the details, but he's had a couple episodes.
Yeah.
And to hear about the episodes, like I said, you'd think he was close to death.
Oh, they'll bring you to your knees, no doubt about that.
Well, this business, yeah, go ahead, Rachel.
When you say dehydrate, how much water should he be drinking?
There isn't a magic number, and 8 glasses a day is what's generally recommended. It's a lot of water. I personally try to get in about 6 glasses of water a day. I just keep a bottle of water with me at all times and sip at it all day.
Yeah. Okay. Well, while we got Rachel on, treatment. What if a stone won't pass? What are some options we have? Because if it doesn't pass, it's going to keep hurting you.
That's right, and it depends in large part on the size of the stone and where in the urinary tract and collecting system it is. If it's a relatively small stone, 2, 3, 4 millimeters, and it's well on its way to the bladder, we'll start people on medication, Flomax. It's called medical expulsive therapy. The idea is just to kind of help the stone make its way through spontaneously without having to intervene surgically. If they're larger stones, then the most common way to approach them is with lithotripsy. This uses sound waves or other forms of energy to break up the stones and from one stone into multiple small stones and then pass them.
Okay. And if it's severe, I guess you can go in and pull them out, right?
We'll go in and retrieve them. Lots of tiny little scopes, a lot of good technology available to minimize the invasive part of that, but yeah, sometimes we'll have to go in and retrieve them.
Well, so Rachel, I hope you can go talk to your brother-in-law and give him all this information. What do you say?
No more iced tea.
No more iced tea.
Sorry about that.
Well,
Thank you.
Thanks for your call. Which brings, I hear more men having stones than females having stones.
Yeah, it's generally more common in men.
Yeah, I mean, I can't remember the last time I heard about a female having a stone.
Oh, it happens.
Does it happen sometimes?
It happens.
Yeah.
And some of them will run in families. Again, a variety of different kinds of stones and presentations.
Have you ever had a stone?
I have not.
I have not either, but someone says it's more painful than having a baby. And I don't know how a person, is
well,
very painful?
And I have heard women say that. They've been in labor and then they've passed a stone and the stone was worse.
So I think that's very good advice. Drink your water. You might even, if you haven't had a stone, you might want to consider cutting back on tea and things that cause stone formation. So I think that's good advice. We're going to have another question right after break. I'm looking at the board here. It looks like a different type of cancer, prostate cancer, the question after break. So we want everyone to stay with us, and you can still get in with Dr. Lee Jackson. He's not going to send you a bill tonight. You can get some free advice, 855-644-3278. And Dr. Jackson's not selling any magic potions, just giving you good general advice that we can all use to live healthy. And we want to invite each one of you, if you're interested in what we're doing, go to our Facebook, become one of our friends. Go to our website. It's heartwiseministries.org. That's how we choose our guests. And stay with us after break. We're going to continue our discussion about prostates and prostate cancers. And I hope our caller stays with us, because we're going to be back with her live after this break.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
3 Angels Live, the first live HD streaming network dedicated to the gospel and 3 Angels messages. 3 Angels Tube flagship HD broadcasting service provides its users with a comprehensive set of tools for producing and managing live HD streaming content. Using 3 Angels Live, you can broadcast streaming HD content from your desktop through your own branded channel. The implementation of the 3 Angels Live platform dramatically cuts the cost of producing and sharing video content online by more than 50%. Whether a church or ministry, 3 Angels Live will save you money while making your message even more accessible. Broadcast using your favorite desktop encoder, Adobe's Flash Media Live encoder, Telestream's Wirecast, VidBlaster Broadcast, or NewTek's TriCaster. If you need it, we have it. Upload and play out your video on-demand content as linear TV-like, or offer your video as pay-per-view content to your audience. And so many more features like create unlimited channels, custom channel page designer, viewer analytics, live chat rooms, video clipping editor, Twitter, blogs. 3 Angels Live. It has finally arrived. The rest is in your hands.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
In our last segment, we talked about stones, and I hope everyone at the break drank a glass of water so that can lower their risk of having stones. Now we have another question that's coming in from Robin, I believe. Robin, you're on with Dr. Lee Jackson. What's your question this evening?
Hi, Dr. Jackson. My father is in his 50s, and his father had prostate cancer. Is there anything that my father could do to avoid the possibility of getting prostate cancer?
That's a great question, and it's a good question in that you recognize that having a family history increases the risk for having prostate cancer. I have a family history. My father had prostate cancer as well. And I can tell you what I do. First of all, I'm vigilant and about following my PSA and getting regular exams. I'm due in 2 weeks for my semi-annual exam, and that will include a rectal exam and PSA. And then one needs to be careful about their diet. Diet does have some contribution to this. It's a little difficult to answer, to give the same answer to that question in that there's so many different kinds of prostate cancers. Certainly there's an inherited form of prostate cancer. There's some prostate cancers that researchers believe may be the result of a viral infection. We'll know more as genetic sequencing is completed on these different prostate cancers. But certainly environmental influences are important, and that is something that we can control. In a short answer, a heart-healthy diet is a prostate-healthy diet. Whatever you're going to do that is going to contribute to a normal weight and a heart-healthy diet is going to have a positive impact on the prostate as well.
Now you mentioned a book that might help.
Well, that's right. There's a urologist at University of Michigan named Mark Moyad, M-O-Y-A-D. You can Google Mark's name and find his book, Prostate Wellness. Mark's been a very serious researcher into the usefulness or charade of using supplements and vitamins. He studied these very carefully. For a while we thought that if we took selenium or vitamin E that this would reduce our risk, and there was a study that was done looking at the value of selenium, the value of vitamin E, their value together. There was no value at all, and in fact they had to stop the study early because the men who were taking so much selenium actually increased their cardiac toxicity and cardiac risk. So we were actually doing harm with that. So it's a very useful book, Prostate Wellness, with a lot of very good advice about dietary, supplemental, and vitamin programs to follow for that.
Robin, any other comments here for Dr. Jackson?
Well, specifically the heart-healthy diet, just so that I don't get that.
Well, I can handle that one. I can handle that one, Robin. As far as the heart-healthy diet goes, well, we want to eliminate or cut back as much as we can animal products in a diet. What might that look like? Well, that might look like trying not to eat big at night, because a big meal at night's not digested. The DASH diet talks about 5 fruits and vegetables a day. Making sure we eat lots of that. Making sure you have lots of fiber, nuts. And then, with some, President Clinton and some others have been able to adopt a vegan diet. That's no meat, eggs, cheese at all. And they actually can remove some of this plaque from their body. But I tell people it's all about balance. And sometimes I'd rather have people eating a little bit bad than being a grumpy person, because I think the chemistry of being grumpiness affects the limbic system and the prefrontal lobe, and that puts stress on the body, and it might counteract some of the effects that you get from diet. So that's why medicine is truly an art. So, heart-healthy diet, lots of fruits, vegetables, nuts, and grains. Try not to eat big at night. And I also include activity as part of a heart-healthy diet. So and I guess it's going to help the prostate too.
Thank you.
Okay, well, thank you for calling this evening. Okay, well, listen, after break, we have a question that's come to our website, and a lot of people have problems with having a big prostate but no cancer. So the next question after break we're going to talk about is ways that they can help the urine flow. This is a gentleman that's getting up a lot. If you might have this problem, you might want to stay and listen with us. We still have some time left with Dr. Jackson tonight. Our phone number is 855-644 3278, and our websites is heartwiseministries.org. And I want you to stay with us because we're going to talk about what to do if someone has a big prostate. This might be a Christmas gift. You might talk to one of your friends and help them out a little bit. So stay with us. We're going to be right back after this break with Dr. Jackson.
The Heart of Health Live will return in just a moment.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
I'm Dr. James Marcum with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thickened, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in 2, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Marcum is doing in your area, visit heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. Last segment we talked a lot about all sorts of things. If you might be having problems with your prostate, we have an expert today on prostate cancer, the treatment, the diagnosis, and all the options. We talked a lot about ways you can prevent from being sick, and I think this is very important because it's much better to detect it early and get it treated rather than to suffer from metastatic disease. Our next question today has a gentleman that comes, Dr. Jackson, says, my prostate is enlarged. What are ways to help me with my urine flow? So let's talk a little bit about prostatic hypertrophy or a big prostate.
All right. Question, in my interpretation, it really is getting at what we call lower urinary tract symptoms. And the size of the prostate may or may not have anything to do with that. Certainly a large prostate is commonly associated with lower urinary tract symptoms, but we'll see men with normal-sized prostates who have these symptoms as well. And by lower urinary tract symptoms, I mean urgency to get to the bathroom. They have a hard time suppressing the urge. They may have difficulty initiating their stream once they do arrive at the bathroom. They may have a diminished stream or an intermittent stream. They may not feel like they've urinated to a point of comfort and feel like they've emptied well. They may need to be returning to the toilet during the day at less than 2-hour intervals. All of those signs and symptoms suggest that there may be some obstruction of the bladder. Nighttime voiding is a little bit different. Nighttime voiding is the one that gets the most complaints because it interrupts sleep. But there are a variety of different things that affect nighttime voiding. In a study that looked at nocturia, and that's our word for nighttime voiding, a big review, tens of thousands of people, they found that men and women will often get up the same number of times at night. Women obviously don't have a prostate. And that the average number for people over the age of 50 was 2 times a night.
Oh, wow.
So I consider 2 times a night to be pretty normal.
Well, that's good to know.
If you're getting up 4, 5, 6 times and it's interrupting your sleep, it may be that there's a problem with the prostate, but that should translate into daytime issues as well.
Okay.
If it's not, and the prostate examination is normal, then they need to look into other interruptions of sleep, sleep apnea, obesity. These things may wake them up, or whatever they've done with their diet early in the evening, or whatever stimulation from computer screens or television at night.
Right.
All of these things that interrupt sleep patterns, and then they're up and they go to the bathroom anyway, and then it becomes a habit. So it's not always the prostate, but certainly that needs to be evaluated.
Right. So let's get to this question. This guy knows he has a big prostate. Okay. What can we do to maybe, what would be some suggestions to a similar patient?
All right. Well, if the prostate is enlarged beyond what we would expect given his age, and it's causing problems, then there are a couple of medications that are quite useful. One class of medication relaxes the muscles inside the prostate, reduces the resistance that the bladder needs to overcome to push the urine through the prostate. And then there's another group of medicines that will actually reduce the size of the prostate by 20 or 30%, and then prevent further growth of the prostate. So if a man has a large prostate, he's having urinary issues that I can assign to the prostate, I believe the prostate is the problem, I'll commonly recommend first the medication that will relax the muscles in the prostate, and then if he's interested in reducing further growth of the prostate, we'll go with that.
Now, a lot of people nowadays are interested in natural remedies. What do you think about saw palmetto?
Saw palmetto does work. It probably has an anti-inflammatory component, reduces some swelling or edema within the prostate. But it does. It's been studied, and it does work.
So that's another option. Have you heard of any other natural remedies?
None that are effective.
None of them. And I like to have these studies that are proven that show stuff. And there's and a lot of people ask me about herbs and substances, and I said, herbs are not that different than medicines, except herbs haven't been studied and they're not regulated. So if you are using substances, you want to really know what's about them. We're about time to go to break, and then we have another question after break about hormone replacement. I hope everyone is listening. Give us a call, 855-644-3278. We're with Dr. Lee Jackson, who's a urological specialist, and his practice specifically focuses on malignancies, it's the prostate. Stay with us, and you can learn more about Dr. Jackson by going to the web or Googling him. Our number is 855-644-3278. We're going to be right back after this short break.
The Heart of Health Live will return in just a moment.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Okay, welcome back to Heart of Health Live. I'm talking with Dr. Lee Jackson, and we have some callers that are getting ready here. And once they're ready, we're going to have them on and answer their questions here. And we've been talking a lot about prostates and all sorts of parts that we really can't see.
Right.
You know, I wouldn't even know some of these parts were there.
That's right.
And it seems like, you know, I don't know about bodies, but as body gets older, the parts just don't work as good.
No, they
Okay. We've got a caller on, and I think it's going to be, the caller is anyone on right now? I don't think anyone's on right now, but yes, we have one caller on. You're on with Dr. Lee Jackson. What's your question?
I had a question about hormone replacement.
Yeah, go ahead. I'm sorry, I missed your name. What's your name?
Jean.
Okay, Jean, go ahead. You're on with Dr. Jackson.
Okay, my husband is interested in hormone replacement for himself. He just heard about this from a friend. And it's supposed to be injections you can get in your hip. I don't know if you're familiar with that yourself, doctor, but they did tell him that he would have to have his PSA level checked first, and I wondered, what's your thoughts on that? I mean, is it supposed to have a problem, have a side effect, the hormone replacement?
Now, is this testosterone that's going to be replaced?
Yes.
Okay, so should they have their PSA checked before getting testosterone replacement?
Definitely. They should check the testosterone level first to be sure that it is out of range. There's no reason to supplement testosterone if it's within the normal range. But if his testosterone is chronically low, then there are health benefits to bringing his testosterone up into the normal range. That's perfectly safe to do. The reason that the recommendation had been made to check a PSA was because prostate cancer is a hormonally sensitive cancer, and if there were an occult or silent prostate cancer present and then we were to start adding testosterone to it, it could act as an accelerant and increase the grade of the prostate cancer. So I will commonly see people who have been advised by their physician to begin hormone replacement to take advantages of all the benefits of normal testosterone levels, but their PSA level is high. That's one of the...
Okay, and what's the level that, I mean, is there a number that...
There is not any one specific number. What I would do if that was the only PSA he had ever had is I would want to check it again in 2 or 3 months and see what it was doing. But I have a low threshold for proceeding with a biopsy in someone in whom there's any question that they may have prostate cancer if they're considering going on hormone replacement. If we do find prostate cancer, obviously we need to address that, get them free of that prostate cancer so that they could then safely receive the hormone replacement.
Okay.
Oh, so it's possible to correct it and then go on. Okay,
oh, absolutely.
That's great.
Okay, well thank you.
Thank you very much.
Thank you for your call. And you know, that's very interesting because one of the treatments for prostate cancer is decreasing the level of testosterone.
Absolutely.
So we don't want to pour gas on the fire.
No, we don't.
Okay, we have another question. I think we had a question, but we lost her. So Susie, are you still on the line with us? No, I think we lost her. I think she dropped off the line here. But listen, we had a question that came into our website that we want to start talking about, and I think it's very important that we talk about this. And this question is, what is the chance of becoming impotent after surgery on the prostate? Is there anything that can improve the odds? So we're going to probably have to break this up into two parts. And first of all, who would need surgery on the prostate?
Okay, and we will need to break this up because this is a complex answer.
Yeah.
The way I think about prostate cancer and what I want people to understand when they come to me is I want them to understand first that prostate cancer is a highly variable cancer.
Okay.
Not all prostate cancers behave the same and they don't present the same level of risk to every person.
Right.
So we will look first at what kind of prostate cancer a man has. We learn that from the pathologist based on the appearance of the cells under the microscope.
Mm-hmm.
We'll bear in mind that prostate cancer grows slowly, so we'll always look at the risk from that particular cancer in the context of a man's life expectancy, and then make recommendations for managing that cancer with one goal in mind, and that is that nobody die from prostate cancer. It's a terrible way to die. We don't want that for anybody, but we don't have to do the same thing to every person in order to achieve that goal. So that's how I kind of start off with it.
Okay, I think it's a good place. Now, after our break here that's coming up, we'll talk a little bit about what would make you decide to take a prostate out.
Sure.
And what would be the different options for taking it out, because I guess there's more than one way. And then we want to talk about becoming impotent. What might be the best one? So stay with us. We're going to discuss these issues with Dr. Lee Jackson after a short break. You can join us at heartwiseministries.org or give us a call, 855-644-3278.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thicken, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in two, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Marcum is doing in your area, visit heartwiseministries.org.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's one every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the tree of life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. And before the break, we were starting to talk about a patient, and we talked about prostate cancer and surgery on the prostate. We wanted to get back on, when would you decide, you've found out that there is cancer in the prostate by a biopsy, the pathologists have looked at it. When might you decide to take the prostate out, and how might you take it out? I know there's different ways: regular surgery, robotic, and we specifically eventually want to get back to what is the chance of becoming impotent, and is there any procedure that might be better than other, or are they all the same?
All right. Well, I talked about what our goal was, which is to avoid death from prostate cancer. And again, that we don't have to do the same thing in every person. We stratify men into one of 4 categories of risk based on what kind of prostate cancer they have, what is their PSA. Okay. There are indolent, trivial forms of prostate cancer that don't need treatment at all. We watch them, we watch these folks very carefully, but generally we don't believe that their particular prostate cancer represents a threat to them, so we observe. There are other men who have what we consider clinically important prostate cancers. We need to intervene in a meaningful and definitive way. But it may be that they'll do just as well with some form of radiation or with surgical management, and it's very much a shared medical decision with those folks. We're guided by their preference. And then there are 2 groups of people that, in my view, need to give very serious consideration to having their prostate removed. Okay. These are high-risk guys who have a lethal form of prostate cancer. I want them to give serious consideration to surgical management because they're likely to need more than one form of treatment. And it's best to start off with surgery, learn from the pathology report just what their risk is after it's been removed, and then supplement the surgery with either radiation, hormonal therapy, or chemotherapy. We can be very specific about our recommendations for supplemental treatment based on the pathology report. So when someone's going to need multimodal therapy, I think it's wise to begin with surgery and then hold off on radiation or hormonal therapy because they may need it either as an adjuvant role or a salvage role if there was ever a recurrence. The other group are men that are young and have a long life expectancy. And I define that as men in their 40s, 50s, and 60s who are otherwise healthy and have a life expectancy that's beyond 15 years. I think the best way for them to solve their problem, live out their life free of prostate cancer, is by having it removed. Now when we intervene with an operation, with surgery, we do so with 3 goals in mind. Goal number 1, of course, is a cure. We want them to live out their natural life expectancy free of prostate cancer. Goal number 2 and goal number 3 are quality of life issues. Goal number 2 is complete recovery of their urinary control. And goal number 3 is preservation of their preoperative level of sexual function. The prostate is a reproductive gland. It makes semen, but because of where it is and because the nerves that contribute to erectile rigidity run right alongside the prostate, it's very difficult to do anything meaningful to the prostate without having an adverse impact on those 2 issues. And it's the issue of impotence that concerns men the most. Obviously they don't want to be wearing pads, but we can generally solve that.
Well, we are going to finish this topic after our break, and I think this is something that everyone's interested in. So stay with us. We're going to talk and answer this question about becoming impotent after the break. You're watching Heart of Health Live. Our phone number is 855-644-3278. And we're here with Dr. Lee Jackson, and we're going to talk a little bit more about the prostate, how impotence might occur after you take a prostate out. We're going to be right back after this short break.